Okay, good afternoon. This is Mr. Mamba. So today I will be demonstrating how to do physical examination of a postnatal woman. So this is a procedure that is done after this woman has given birth. Supposed to do as a nurse or as a student, you're supposed to assess the patient head to toe. So during postnatal, this is the period after delivery. So during this time, you're supposed to do an assessment in order to detect if there are any abnormalities, and you'll be able to help this woman. So I'll start, I'll demonstrate how it is done, and make sure to follow and ask questions where you are not clear. So physical examination of a postnatal mother, this procedure is done 4 to 6 hours after this woman has been admitted or after the woman has given birth and taken to postnatal ward. So before discharge also, before you discharge this woman, you're supposed to do a physical examination where you do a full physical examination from head to toe. So I'll start. First, during OSC, in case this procedure comes, you're supposed to wash your hands. Wash your hands and dry them. Then you go to the patient. So, good afternoon, Mrs. Mbewe. I'm student number 84. I've been assigned to do a physical examination on you. This is a procedure that I'll do in order to detect if there are any abnormalities. So you tell this woman. So whatever, everything that I'm going to do, I'll make sure I've screened to ensure there's privacy, and no one will know about anything that I'm going to do. So you've gotten permission from the patient or from this mother. The next thing you're going to do, you start examining this woman. So during OSC, you find there are screens. There's no need of you getting screens and you start putting them there. No. So after getting permission, you can get examination gloves. You put on examination gloves. Then assess where the patient is sleeping so the linen is not soiled. Okay. Then you can leave it like this. Then at the hospital, it is important to do a quick assessment in order to know if the patient is in pain. Also to know if the patient is depressed. After this woman has given birth, you find that maybe this woman is in pain or the woman is undergoing depression. So it's important to detect that. So if this woman is in pain, it is important you as a nurse, you give analgesics such as diclofenac, or depending the level of pain after you've done an assessment, you can give a suitable analgesic. Then if this woman is undergoing depression, before even do this procedure, it is important you do counseling on this woman. So counseling can be done so that this woman can feel better. Then after you've done all these things, then you can do the procedure. At times when this woman maybe has not, you've not done urinalysis, you can also do urinalysis. You do urinalysis in order to detect other abnormalities. Then if this woman is able to make sure this woman is in supine position, then you start the examination. So when doing this examination, I'm starting from head, going this side. So it is important to check the hair. How is the hair? The color of the hair. So we're able to know if this woman is malnourished just through the hair. The nutritional status, we'll be able to see the insight of this patient's nutritional status. So it's important we just assess the hair. So if this woman has got is malnourished, you find that the hair will appear brownish. Then also hygiene status on the hair, you're able to see this woman. Has this woman combed the hair? You check how the hair is. So hygiene status, you are also going to assess the hair. Then from the hair now, you come to you go to the eyes. So on the eyes, we are going to check if there's any signs of pallor. So you check, there are no signs of pallor. So we are able to detect if this woman is anemic by checking the eyes. Also, you check if the eyes are there's jaundice. You check if there's jaundice in the eyes. So if there's jaundice, you find that the eyes will appear yellowish. So from the eyes, we also check in the eyes if there's any discharge coming out of the eyes or any dirty hygiene status of the patient. So from the eyes, we'll go to the mouth. So in the mouth, we are checking the hygiene status. Also, we check if there's any um, dental cavities. You check, or dental caries. You check in the mouth. If there are any, then you can call the dentist so that they can review the patient. So from there, you come to the neck. In the neck, we are checking for enlarged thyroid gland. We check if there's any enlargement of the thyroid gland. Okay, so in the actual sense, the normal will say there's no enlargement of the thyroid gland. So from there, after assessing the neck, we'll come to the chest. On the chest, we are checking the two breasts. So the two breasts are there, and we check the fullness of the breasts. We also check the nipples if they are present, and we also squeeze a bit so that we are able to check if the ducts the both breasts, the ducts, are they patent. So we'll be able to see colostrum coming out, which is a normal thing. Then we'll come to the hands. So here we are assessing, we are checking for any signs of pallor. So there are no signs of pallor. If there are signs of pallor, that will show that this woman um, is anemic. Then also in the armpit, we check if there's any enlarged lymph nodes. This can be sign of systemic and local infections. So there is no enlarged lymph nodes. Lymph nodes are not swollen. Okay, so from the hands, you check both hands, you do an assessment, then we'll come to the abdomen, we check if there's any distended abdomen. In this case, the abdomen is not distended. Then, still on the abdomen, we have a measuring tape. At this point, you're supposed to palpate the abdomen so that you're able to feel how the uterus is. So the normal is supposed to be, the uterus is supposed to be firm. If the uterus is bulky or tender, it means they are retained products of conception, which is not normal. So you find that this woman will be bleeding because the uterus has not yet contracted. Then you get a measuring tape. After you get a measuring tape, it's important to measure the height of fundus. So from where you feel the resistance up to the um, symphysis pubis, you measure the height of fundus. This is after this woman has given birth. And after you've done this, it means you've assessed the abdomen. After assessing the abdomen now, we are coming to assess the vulva. So before we assess the vulva, we're supposed to change gloves. So if there's any pad here, you remove the pad, you put it in a plastic or a leak-proof container, then you do an assessment. Here we are checking if there are any clothes. So these gloves, you can even change the gloves. These you throw them and you do a sterile hand washing here up to the elbow, even this side up to the elbow. Then first you dry up to the elbow. Then this So at this point, we've already removed the pad. So you assess, you check the vulva if there's any warts. You also check if there are varicose veins. You also check in the vulva if there are any clots and any tears. If episiotomy was done, you check the sutures, how tight the sutures are. Then at this point, after assessing the vulva, when you've assessed the vulva, you've checked for all those things, it's also important to check um, the, the lower limbs if you've not assessed the lower limbs. So at this point, we've assessed the vulva. Now you assess the lower limbs. So on the lower limbs, okay, so I'll expose the patient from this side. So you check the lower limbs, you check the nails for signs of pallor. You also check the ankle for ankle edema. Any edema, you check for that. Then you can turn the patient, you check on the back if there's any swelling on the sacral region. After that, it means you've done an assessment on this woman postnatally after giving birth. So this is how you do it. If there's need of changing the pad, after you've done this procedure, you can get a new pad, you put a pad, and you continue assessing this woman. If the woman is losing a lot of blood, it means maybe there are products of conception or that have remained. Okay, so this is how you do it. When you are done, make sure you leave this woman in a comfortable position and explain your findings to this woman so that in case this woman is anxious about something, make sure you make the information available to this woman. Okay, thank you very much.